I'm Dr. Tish from Recharge Clinic, and today I wanted to talk about a subject that most people have been hearing about but are not totally aware of. You know, there's the term that's being thrown around, low T syndrome, and we see a lot of commercials for that, and there's a lot of talk about it amongst men, low T. But what is low T, and more importantly, does it only affect men? Well, the answer is it's low testosterone, and no, it does not only affect men. So I'm going to talk about why it affects women and what it does to women and why it's important for women. So low testosterone, men and women both have testosterone throughout their whole life. It starts dropping in women in their 30s, their levels, and as it gets lower and lower, they have the same effects on their body and mind that men do. So really women have about 1/10, like I said, of the amount that men do. And so it serves the same function in both men and women. It helps with their mind for mental clarity, moods, motivation, things like that. And physically, it helps with bone density. It actually reverses osteoporosis and helps increase bone density. It helps with muscle integrity, so that's where we burn our calories. And it helps with sex drive. So it's really important for men and women for that. And so one of the things that happens as we get older and our testosterone drops is our sex drive goes down. And so it's not just the fact that our sex drive goes down from the testosterone, but it's all of the other things that go along with it. So when people don't have as much energy or they're moody, certainly their interest in sex is gone at that point because they're just too tired. And so really it's very all-encompassing in someone's life. It doesn't just target one area where we give testosterone and then that increases just your libido. It does do that partly, but it actually works totally in your body. It works in your mind to increase energy levels, increase motivation, increase general sense of well-being. And so then it also helps your body feel better because really it's going to get rid of a lot of the little minor aches and pains. Sleep is much improved with that. And as we know that it starts increasing the muscle integrity, you're going to burn a little bit more calories and slim down a little bit. All of those things contribute to sex drive. It's not just one thing alone. And so testosterone has definitely been shown to do that. There was just another recent study that came out about menopausal women and treating them with testosterone, and was the benefits, were they outweighed by whatever risks there were? Well, they had no risks, and they definitely proved that there was benefits in everything, in mental clarity, moods, as well as physical findings of bone density and sex drive. So this is a very commonly studied thing, and it's had very good positive results as well. So it's one of the things that we need to address for men and women. And I just wanted people to be aware that it is not something that affects men only. It does affect a lot of men for sure, and they have the same physical effects of it. They have lots of fatigue, lack of motivation, and then with time, their sex drive goes down as well. So it's something that if you're feeling tired, having low energy, weight gain, all of that kind of stuff, sex drives diminish, it's something that's worth looking into, and it's very easily treated. And that's something that I think is really important, and people should to really consider when they're having any kinds of symptoms.